Good evening. This is All India Radio Kohima. I'm Jonas Yantan with Evening News. The headlines. Member of Niti Aayog VK Paul warns outbreak of COVID disease can increase in children if coronavirus changes its form. DCGI relaxes provision of post-approval breaching trials and batch testing of imported COVID vaccines. Chief Minister Neiphiu Rio holds monsoon preparedness meeting. Says preparedness will help mitigate major disasters. And Deputy Commissioner Kohima says Kohima district witnesses substantial decrease in COVID-19 tests due to hesitancy. In the wake of COVID-19, we appeal to our listeners not to lower your guard, stay safe and protected by following these 4 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene, and get vaccinated. For providing COVID-related information and guidance to the people, national helpline numbers are 011-2397-8046 and 1075. And state helpline numbers are 700-5539-653 and 1800-345-0019. Now the news in detail. Niti Aayog member Health VK Paul has warned that the outbreak of COVID disease can increase in children if the coronavirus changes its form. He said that the childhood COVID disease is gaining attention in the country. He added that the COVID-19 infection has not taken a serious shape among the children. Paul said COVID-19 in children is often asymptomatic and rarely requires hospitalization. However, it is possible that 2 to 3% of the children who get infected may need hospitalization. He assured that all the arrangements and steps will be taken to contain the spread of COVID-19 among children. Paul has informed that a national expert group has been formed to review COVID-19 infections in children and approach the pandemic in a renewed way to strengthen the nation's preparedness. He said fresh guidelines will be adopted based on review of the data by the expert group. Drug Controller General of India, DCGI, has relaxed provision of post-approval breaching trials and batch testing of imported COVID vaccines in a bid to further expedite its availability in the country. The Central Drug Regulator has said that major relaxations are already in place to aid quick and seamless vaccine import. It added that as per the recommendations of the National Expert Group of Vaccine Administration for COVID-19, the requirement of conducting post-approval breaching clinical trials and the requirement of testing of every batch of the vaccine by the Central Drugs Laboratory CTL Kasoli will be exempted. The exemption has been given to vaccines which have already been approved by USA FDA, EMA, UK MHRA, PMDA Japan, or which are listed in WHO emergency use listing and which are well-established vaccines from the standpoint that millions of individuals have already been vaccinated with it. However, the DCGI has informed that scrutiny and review of the summary lot, protocol and certificate of analysis of the vaccine batch will still be undertaken by CTL Kasoli. The government has imposed restrictions on the export of amphotericin B injections. The antifungal injections are used in the treatment of mucormycosis known as black fungus. In a notification issued by the Director General of Foreign Trade, the amphotericin B injections have been put in the restricted from free category. Justice retired Arun Kumar Mishra today took charge as the chairman of the National Human Rights Commission (NHRC) in New Delhi. President Ramnath Kovind appointed Justice Mishra as the NHRC chairperson based on the recommendation of his selection panel comprising Prime Minister Narendra Modi, Home Minister Amit Shah, Lok Sabha Speaker Om Birla, Deputy Chairman of the Rajya Sabha Hari Vansh, and Leader of Opposition in the Rajya Sabha Mallikarjun Kharge. Justice Arun Mishra retired as Supreme Court Judge in September last year. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on our YouTube channel, AIR News Kohima. Chief Minister Neiphiu Rio, who is also the chairman of NSTMA, today held a monsoon preparedness meeting virtually at the CM Secretariat in Kohima. The meeting was attended by ministers, administrative head of departments, Nagaland State Disaster Management Authority (NSDMA), line departments, deputy commissioners and chairman DDMAs. The meeting discussed matters related to road, emergency operation and response preparedness and availability of essential commodities. Chief Minister said preparedness will help mitigate major disasters, if any, during the monsoon season. Deputy Chief Minister Y. Button, in continuance of his COVID-19 Woka district tour, today distributed PPE kits, sanitizers and extended financial assistance to the primary health centres of Jugutung, Niro and Englan under his constituency to the respective medical officers in the presence of the Chief Medical Officer, Woka. Button also urged everyone to remain cautious as one continues to fight against COVID-19. Deputy Commissioner Kohima Gregory Tejavele said that testing for COVID-19 has been on a substantial decrease in the past few weeks in Kohima district owing to testing hesitancy. In this, he opined that this could be fear of stigmatization or fear of being tested positive if diagnosed. Tejavele said that early testing or detection and isolation is one of the best tools to break the chain of infection, and early testing and detection will be highly beneficial in reducing the mortality due to COVID-19. The Deputy Commissioner further reminded the people that any resistance or refusal to test by known contacts of COVID-19 cases is deemed to violate the Nagaland Epidemic Disease COVID-19 Regulations 2020 and liable to be booked under Section 188 of the Indian Penal Code. The country is witnessing a significant sustained decline in active caseloads and fresh COVID cases. The daily recoveries continue to outnumber the daily new cases for the 20th consecutive day. Over 231,000 patients have recovered from coronavirus in the last 24 hours. The recovery rate has further improved to 92.48%. The Health and Family Welfare Ministry has said that the active caseloads presently comprise 6.33% of the cumulative positive cases, and it is continuously declining. It said degrees of over 1 lakh active cases is registered in the last 24 hours. At present, there are over 17,93,000 active cases. Arogya Setu has rolled out a feature to update vaccination status on the Arogya Setu app. Ministry of Electronics and IT in a statement said that a vaccination status can be updated through mobile number used for COVID registration. Those who are fully vaccinated will get a blue shield on the home page of Arogya Setu app with double blue ticks on the Arogya Setu logo 14 days after the second dose. This is done after verification of vaccination status from the GoWin portal. Those who have got a single dose will get a single blue border with vaccination status on their home screen, along with Arogya Setu logo with a single tick. Vaccination status of those registered on GoWin with another mobile number can also be updated. The vaccination status for such users on Arogya Setu will be updated by checking the status through the mobile number which is registered on GoWin. Such persons will be asked to enter the mobile number registered on GoWin when they try to verify their vaccination status. On entering, an OTP will be sent on mobile number. This OTP will need to be entered by the person verifying his vaccination status, and then he will be able to select his profile from the people linked to the GoWin registered number. On selection of the correct profile, the vaccination status will be confirmed from the GoWin back end, and the same will be updated on the Arogya Setu app. And now, 20 news, here are the main points again. Member of Niti Aayog VK Paul warns outbreak of COVID disease can increase in children if coronavirus changes its form. DCGI relaxes provision of post-approval breaching trials and batch testing of imported COVID vaccines. Chief Minister Neiphiu Rio holds monsoon preparedness meeting, says preparedness will help mitigate major disasters. And Deputy Commissioner Kohima says Kohima district witnesses substantial decrease in COVID-19 tests due to hesitancy. That is all we have in this evening news bulletin. Good night.